ma'am.
I can hear you.
If people usually join sometimes like 10 minutes afterwards, 15 minutes afterwards, after we've started.
Okay.
So if I say we should wait for them, that might eat into our time because it's Zoom. Zoom is always very time conscious and they're not very generous with time. So, ma'am, I would like to introduce you already so we can start, if you don't mind.
Okay. No problem.
Joining when we started. Anyone that misses out on any of the important parts, because I know every part you're going to be sharing is going to be very important. So they can always go back to the video and watch and also
Okay.
so yes, ma'am. Let me do the honors of doing an introduction right now. I do not have your profile, but maybe you would, if you don't mind, ma'am, help us help us by doing that introduction of who you really are to us and all that you have, maybe like a summary. Because if I say you should start telling us all the places you've been and everything you've done, we probably will have the entire session concluded just for today.
Okay.
Yes, ma'am. Please
Okay.
do well by letting us know who you are, what you do, places you've been. The
Okay.
floor.
All right. Thank you. It's an honor to be here. It's not always that you have the opportunity to pass on knowledge or to share experiences. So I'm actually really, really honored to have this opportunity. So my name is Tenite, um, chartered HR business partner, a business analyst, HR professional, and a fellow of the Chartered Institute of Human Resources Management. So I have over 20 years experience, 15 of these years spent in office management and human resource management. So I have been opportune to work with a real estate business. I've had a stint with HR consulting. I actually branched out on my own during the COVID era, where I had to work with a few companies as a HR consultant and a HR business partner. Currently, I am the HR manager for a top paint manufacturing industry in Nigeria. And yes, so the topic for today is actually a special one to me because I've had experiences working with them. I've had bitter occurrences due to HMO lapses. I've had, in fact, I've had to almost um, take legal actions against some HMOs and healthcare providers. So it's something that has actually I've worked with for over 10 years. And as much as possible, I will try to share my experiences and the knowledge I've gathered over the years. So that's just a little bit about myself.
Thank you so much, ma'am, for sharing with us all of that. That was very quick.
Welcome.
I was thinking to get to know more, but that's fine. Maybe over time we'll get to know more, ma'am. Thank you so much, ma'am.
Sure.
If you don't
You're
mind, ma'am, the
welcome.
floor is still yours. I'm very excited
Okay.
about today's topic and today's session. Like I told you earlier, I'm actually looking forward to also learning more and listening to you,
Okay.
hearing tell us all that you've experienced regarding HMO and the pleasant,
Okay.
unpleasant experiences that you have mentioned. So please go ahead, ma'am. Let's hear from you. What would you say
Okay.
HMOs are? Would you say we have a great system of HMO in Nigeria or we have a poor system? How can it be better? What have you seen? Please share with us, ma'am.
Okay. All right. Um, I would like to share my screen, if that's okay.
Please go ahead, ma'am.
Okay. All right. So, is my screen visible now?
Yes, ma'am, it is.
Okay, great. So, let's do this. I need to. Okay. So we're going to be talking about the universally accepted HMO system. This topic is very broad, and as much as possible, I'll try to break it down, and within the time frame that we have, probably give out as much as possible. So we're going to introduce the topic, demystify HMO. We're going to talk about the key components, how it works, the benefits, and of course, the limitations. Then it's really, really important for us to understand how to choose the right HMO. Then what then is the universally accepted HMO? Then, of course, questions. So let's move on. According to the labor law, any organization or employer, be it a one-man business, a limited liability company, as long as you have more than 5 employees, it is compulsory, statutory, that you have a health insurance system for your employees. It's non-negotiable. So this is actually stated, apart from the labor law, Nigerian labor law, it is stated in the National Health Insurance Act of 2022. And also, this HMO, sometimes the responsibility of covering it is shared between the employers and the employees. What this actually means is that some employers take a portion of an employee's salary.
Is the network
Add to it and pay for a health insurance scheme. So that companies, they actually cover 100% of the health insurance scheme. Can you hear me? Hello? Can someone hear me?
Yes, ma'am. Yes, ma'am. I can hear you loud and
Am I
clear. Please,
still
if you
on?
can hear Mrs. Jane, can you put it in the chat box that you can hear her, please? Okay, ma'am, we can all hear you. It's like the network is freezing, but
Okay,
I think
thank
it's better
you.
now. Yes.
So let's proceed. Hello? It's better now. So there are different health insurance providers, both at the national, state, and private level. So for the national level in Nigeria, we have the NHIS, which is the National Health Insurance Scheme. NHIS is owned by the federal government, managed by an organization, and some companies use it, but mostly public sectors, federal ministries, those are the people that actually take advantage of NHIS. Also, for individuals who are not under corporate organizations, they could also register under NHIS. I think they have individual plans. So NHIS is the national body that provides health insurance for Nigerians. Since it is really, really compulsory for all Nigerians to have health insurance cover, it's not just limited to corporate organizations. Individuals can have access to health insurance through NHIS or through some of the HMOs. We'll get to it. Also, there are state-owned health insurance schemes. We've heard of the popular Ilera Eco, which is in Lagos. There's the Oyo State Health Insurance Agency, which is Oyo State. There's Delta State. There's one for Anambra State. Some states also have dedicated health insurance schemes for their indigents. I think it's accessible wherever you are, as long as you're an indigent of that state. Then we have the HMOs, which is actually the health maintenance organizations, which is the core of our topic today. So these HMOs are actually run by probably individuals, corporate organizations, even some hospitals have HMOs registered under them, or they have their own HMOs that they run. This makes it easier for them to attend to patients. Okay, so let's get into it. HMO, like I said, it stands for health maintenance organizations. HMOs operate in different ways. So you have a fixed fee that you pay, which is actually referred to as premium. Some do quarterly, some do annually. So HMO has a network of providers, which is actually the hospitals, the laboratories, the dentists, pharmacists. So they have all these healthcare providers that are accessible to people registered under their network. They operate by, having limits per coverage, depending on the plan you're registered in. So basically, some organizations do not register with HMOs. Some prefer to tell their staff to go for medical cover, bring their receipts and claim their money. This is actually not so bad, but the flip side is a lot of people would I say, boycott all of this so that probably at the end of the year, they can claim this money in bulk. Sometimes the organizations do not cover everything because they expect you to pay. If you are a low-level staff and you want to go for surgery, and we all know how the medical system works now, is actually you have to pay before you get any care. So for a low-level staff who is earning 100,000 naira or probably lower, let's just take example, minimum wage, and you need to access care, probably yourself or any member of your family needs to undergo surgery. In this type of system, you're supposed to make payment for this service, then come and claim your cash from the organization. Now, how do you now access care if you cannot afford it at that time? So it still boils down to you being stuck because you do not have the fund to access the care before you go claim the cash from your organization. But for HMO, it is different. The premium is paid at the beginning of the year. So whatever it is that you want to access throughout the year, you have access to it. There's always a catch, though. There are limits, there are different plans, different coverages, depending on what you have agreed with the HMO or how much you can afford to pay as an organization per staff. Okay, so let's go to the key components of the HMO system. We have the network-based care. So the HMO contracts with a network of healthcare providers. So what they do is they actually approach these hospitals. They undergo a lot of, back and forth negotiations, some of the plans they can offer, some of the services they can give, and how much a fixed amount they can pay for the year for cover. So this cover is actually accessible to everybody on the system. Then we have the primary care physician, which is, of course, the hospitals that are under the network. For some HMOs, you can actually access care. We have telemedicine now. You can access care from your phone. If you have an emergency in the night, you can actually get access to care or consult a doctor on your phone. So these are primary care physicians. Then other component is referrals. For you to be able to see a specialist under the HMO, you need a referral. So you can't just walk in and see a gynecologist. You can't just walk in and see an ENT. You can't just walk in and see a physiotherapist. You actually need a referral from a general physician before you can access care or you can see a specialist. So we have the member contribution. Of course, the member contribution is what I refer to as a premium, which is paid at the beginning of the year or quarterly, depending on the contract you have with your HMO organization. So these premiums actually differ. We have different plans, we have different coverages, and we have different scope of cover. So all of this we'll touch on as we go further. Then another key component is out-of-network costs. It is important to know that if the HMO has provided you with a list of hospitals or providers under their network, however you feel about these providers, you will have to make use of them. Because if at any point, apart from during emergencies, if at any point you access care or you go see a doctor or you see a physician that is outside the network hospitals, you will have to bear the cost yourself. So those are some of the components that we actually need to understand about HMOs. Outside of their providers, you will pay off pocket. However, in cases of emergencies, we've had emergencies where probably accidents have happened on the way and you contact them, your own primary care provider or a network hospital is far from the scene of the accident. They will give you access or permission to access care in any hospital around that place. That's actually mandatory because while transporting the patient or the accident victim, something might happen. So there are exceptions to the rules. Every rule has an exception. So that is one of the exceptions. Then we have the coverage limits. Let's take an example. You are using, let's say, Ilera Eco, and your plan is probably the basic plan, and your premium is probably 200,000 a year, and your limit, your coverage limit is usually probably 1.2, 1.5, also depending on the plan. So every care you access has limits. So for some, they have their intermediate, basic, and major surgeries. They have different limits. For some, they have one limit, coverage limit, covering surgeries. So in this case, it means that if you're going for a major surgery and your limit, your coverage limit for surgeries is 300,000, and the cost of your surgery is 500,000, the HMO will only cover up to the coverage limit of 300,000. So the balance of the 200,000 will have to be paid and borne by the employee or the principal, as it is referred to. So those are the key components of HMO. Please let me know if I have people with me.
Oh, yes, ma'am, we are with you.
Do I have any questions so far?
Not yet.
Any questions so far?
Not yet. They will put in their questions in the chat box as they usually would. But for now, we do not have.
Okay, all right. So how does HMO work? It's actually a simple process. At the beginning of the year, we engage our HMO, we agree on the plan, we agree on the network providers, and the premium is paid. So at any point in time, when you have any reason to access care, even if you're not feeling good or you don't like the way your body feels, you have a headache that is inexplicable, or you just basically have stomach upset, you can access care. You can go to the hospital. It's not until you have something serious, something life-threatening, or something inexplicable, the care is available to you anytime, any day, regardless of what. So HMO covers from the lowest to the highest, according to your plan. So for some HMO, they have the lower plan, intermediate, they have the senior plan, they have the executive plan, they have platinum plan. So it depends on the organization, what they plan to cover for staff, and of course, how much they can afford to pay per staff. So that is how it works.
Okay, ma'am,
Then
I'd like
to assess,
I'd like to ask a question there. I hope you don't mind.
shoot, no, no,
Yes.
please go ahead.
So I'm going to ask a question that I usually get, I mean, as an HR person, right? So I was going to
Okay.
ask, one of it was the one you just answered. I wanted you to actually touch base on those plans, you know. Sometimes
Okay.
organizations, yes, they will go for plans that they can afford. But we have
Okay.
organizations that go for plans that they go for the plan to fulfill all righteousness that they're doing HMO. But the truth is, the HMO
Yeah.
is not covering major. So sometimes HMO organization, oh, yeah, the HMO, you know, bodies, they have those plans to just get you on board with them. But the truth is,
Mhm.
you only get to benefit mostly from it if you are subscribing or signing up for a plan like maybe intermediate plan, or maybe sometimes they call it golden plan or platinum and all of that. If you do the basic lowest one, you don't really get to enjoy it more, maybe just for malaria or for headache or something like that. So there was a company I
Uh,
worked for, they were
okay.
going to sign up for a plan that would not even cover, I'm not sure it covers for anything after malaria. Aside from malaria, like you can't do an eye check. You can't just go for a scan or something like that. That covers for. So this HMO, you know, bodies, they have the way they break these things down. So what about
Mm.
organizations, man? Let me just ask you, man, so you can just flow
Okay.
onwards with the topic. So,
Mhm.
like I shared with you, there are staff or employees who have issues with their company saying they have HM1, yet they still have to provide receipt, you know, from the hospital. Like,
Mm.
and there are some that it's until they fall ill that they actually have access to the HMO. Like, they can't just on their own say, okay, I want to have a checkup or something like that. They have to be sick or something. And
Mm.
whereas there is a deduction from the gross salary for the purpose of health, I mean,
Mhm.
it's listed there in the contract, okay, the breakdown, right? And then they don't
Mhm.
have access to that. I mean, sometimes for a whole year, some staff, 2 years working in the company, they've never really had access to their HMO. So the money, is it theirs or really is it not belonging to the company if you look at it really, really? So, Mama, I'd just like you to touch on these things I have said.
Okay. All right. First, let's address the plans. For me, or from my experience, what is actually best is you have an ironclad agreement with these HMOs. There are different plans. Where I am now, we actually have plans for casuals, like temporary staff. Because it's a manufacturing organization, we can't just let people come work without cover because, factory accidents, you inhale chemicals. We want them to be able to access care just in case they fall ill, regardless of what the illness is. So to address this, you actually have a list of plans. We'll go into how to choose HMO in the course of this talk, but actually, the organization needs to know what the HMO is offering. Then we also need to sensitize staff because some of them really don't know what they can get from this HMO or what they have access to. So it's actually communication is key. It's actually important to tell them that, okay, this is your HMO plan, and these are the care or these are the things that you have access to. Sometimes it's actually the fault of the hospitals because if you're using a low plan and you go to what will I say, a premium hospital, of course, what your limits on that lower plan can get you in that premium hospital will be very limited. So
Yeah.
it's actually, that's why these HMOs have different levels of hospitals for different plans, so that you know that you can access maximum care regardless of your plan at the hospitals that fall within that plan. So saying that depending on your plan, you can only have access to, or you can only be treated for malaria, that's actually a misconception. And it's just because there's no proper communication, whether at the senior level or from the HMO to the staff, to the management, or from management to the staff, because they need to understand that HMO covers everything. You have access to scan. The limit for investigations might be 300,000. And of course, if you want to go for MRI scan, 300,000 will not cut it. Because of course you need to leave space for the basic blood tests, urine analysis, stool function, all of those tests. You need to actually have access to those tests. So if on a very low plan, like the plan for the casuals we have in my organization, MRI scan might not work. They might have to pay off pocket. So, but the basics, malaria, typhoid, ultrasound, name it, urinalysis, you have access to it. Your surgery limit might be low, but you have access to surgery. So that's communication is key between the HMO and the management, between management and the staff. Then it's also important for you to clearly state what and what is accessible to employees per plan, so that as a HR person, it will actually fall on your table when a staff is in the hospital, probably an emergency, and you get a call that the HMO is not answering me, they're telling me I'm not covered, blah, blah, blah. You just tell them, what plan are you? Okay, this is the limit for this thing you want to access for your plan. Every other thing, I'm sorry, you have to pay off pocket. It's something they know. But because of the agitation and the emergency situation, they want things done quickly. And sometimes you don't blame them. They might not have the money to pay for the extras. That is why the HMO, the HR person actually needs to be able to manage situations like this. Sometimes in this situation, you might say, okay, let's see what the company can do for you. We'll probably cover it while we deduct it from your salary, or let's see what we can do. You call on the HMO, okay, HMO, bear the cost, send us the bill, and all of that. So there are ways to manage these things, but really, to really answer your question, communication is key. Having an ironclad agreement at the beginning of your relationship with this HMO actually helps, so that when you are calling them, like I have to do so many times, you call them to, or let's say, bombard them and say, okay, hey, what's going on? I have a staff in the hospital here trying to access this service, and they are being told that they cannot. But according to our contract, it is covered on page this, number this, paragraph this. So many times I've had to direct them to that contract. And we're like, oh, I'm so sorry. Oh, we'll call the hospital now. So it's really, really important for you to have a tight agreement with these HMOs, because of course they might want to cut corners so that they can make more money. And it's insurance. Yes, it's insurance. If you refuse to access care for the whole year, most times the agreement or the contract is for 1 year. After 1 year, you have to renew. If you don't access care, of course, they will not refund you.
Exactly.
If you access more than you have paid, you will not refund the HMO. So it's insurance. You win some, you lose some. But basically, communication is key.
Thank you so much, ma'am, for answering that question. I think that's the fastest way I've ever I've ever gotten that question answered. Most times I throw it open. It's always a whole lot of instances, a whole lot of experiences that people have had that they're not very pleasant like that. So thank you, ma'am, for
Mhm.
shedding light. This is the point where I'm going to ask if anyone has questions at this point for our guest speaker today. From everything you've heard, everything you've learned in this short time, or even anything you have experienced or you're experiencing at all right now regarding your
Mhm.
HMO at your office and your organization. You don't even have to tell us the name of the organization. Just tell us,
Mhm.
like she said, communication. And then you also said another thing, ma'am. You said that the employees need to be yeah, it's also communication. But if people are not communicating to you, if your HR is not communicating to you, you mentioned something, ma'am. You said there are times where you have to come into play. There are times you have to make the call. You
Mhm.
have to tell the
Yes.
HMO. You have to tell the hospital, or to attend. There are HRs that are not very proactive in that regard. Like they are not. Sometimes people tell me some of the things they go through, and I'm like, okay, your HR, where did they come from? What are they doing exactly? What is their role? So there is a role for the
Mhm.
HR to play. There's a role for the employees to play as well. And what is that role? If you're
Yes.
here and it seems like you do not even know what your rights are, what you're entitled to in terms of HMO in your organization. This is the time to ask questions. This is the time to get knowledge. And don't let one
Mhm.
year just bypass and then there's a deduction in your gross salary. Because most times we just care about the take home. I don't know if you get me, ma'am. What's the
Yes.
net? I don't really care
Yes.
about gross, but then when they tell you your gross is 500K and you're not taking 500K, you should be asking what is what I'm not taking with me? What are they using it for? Where's it going?
Mhm.
They say it's for
Yeah,
your
true.
good. Where lots of companies will list it out for you: housing allowance, feeding allowance,
Mhm.
all of those things. They're just on paper. You don't even know what goes on with it, and you don't care because why? So far as you take your take home, this is a wake up call to actually care about those things. Ask your HR questions. Get to know
Mhm.
all that you need to know about what you need to know. So at this point, I still haven't received questions from the chat box. Okay, I'm getting one now. I don't know. Yes, somebody's asking,
Okay.
ma'am, can HMO be monetized in an organization? Like, let them just give me my
Okay,
money. I don't fall sick, Abby.
I think I've gotten that a lot because some people say, well, I don't even use the hospital. I don't fall sick. Can they give me my money? Like I said, if it's a HMO, of course you will not get your money. It's an insurance. You use it, you don't use it, you have to pay, and there's no refund. It's just like your car insurance. You get to renew it every year, whether or not you have an accident. The next year you renew again. Whether or not you have an accident, the next year you renew again. Of course, no one is praying for an accident. That's the same thing with HMO. HMO is a health insurance scheme. Whether you use it or not, you get to renew it, and there's no refund. Because of course, sometimes you find out that you overshoot or you overspend or you overuse um, more than what you have paid in.
Yeah,
How they operate is they actually, rob Peter to pay Paul. So an organization has like 100 staff, and just about 20 to 30% of them, or let's say, okay, let me not be too, let's say like 60% of staff actually access health. Not every day. Of course, we don't fall sick every day, but at least 60% of staff get to use the HMO, the health insurance. But you see
insurance.
that some 40%, they don't really fall sick. Some are used to over-the-counter drugs. They just go buy paracetamol or
That's a
something
short
and they're
term
fine.
self-treatment.
So exactly. In that instance, the premium you paid for those 40% will be used to cover for the 60% who are actively using the service. So that's
Mm,
how it actually works. So it's not like your money is there sitting and making money for them. They're actually using it. So if you use it, if you don't use it, you don't get no refund. But
okay.
in case where the organization has this this you go access care, then bring your receipts, we'll give you the money back. They actually have a limit that you have access to, depending on your level in the organization. So for some
Okay.
organizations, they might say, okay, if you don't use it at the end of the year, it's paid to you. I've worked in a place where that happened. So at the end of the year, if you don't go to the hospital, you don't have access, or you didn't get to claim your medical allowance, that's what it's called. You don't get to claim your medical allowance. Yes, at the end of the year, the bulk of the allowance is paid to you. Some organizations do that, but of course, it's not statutory. You are supposed to have a health insurance scheme according to the labor law.
Thank you so much, Mama. I'm so sorry. I didn't want to
You're
cut you off.
welcome.
The call will end any
You're
moment
welcome.
from now. But you guys, please join next week. We'll continue on this HMO session with Mrs. Jane Tenite.
Okay.
Thank you so much, ma'am. Thank you, everyone, for your time
You're
today.
welcome.
It's really a short
Thank
time as
you.
usual. Please do well to follow us on all our social